this is small family gatherings, small friend groups, birthday parties, dinner parties, where you're around family and friends that, you trust. You don't think of them as infected. And they don't know that they're infected, because about 40+% of this spread is by people who are asymptomatic, who by definition don't have symptoms, are not aware that they're infected, and yet can spread it. It wasn't too long ago, we were looking at hot spots. It's everywhere now. Just since election day, 1 in 400 Americans has gotten infected with this virus. So it's important to look at community transmission, because there are community practices that we can do that would protect us. You're sitting across from the table from one another, having discussion. Oftentimes alcohol is involved, and then people start speaking louder, and that's a transmitter for this. So I think it's all happening in the context of so-called COVID fatigue, right? We are made as social beings. We're made to be in community with one another. And it's been very tough for some people to adhere to that. And unfortunately, they're paying a terrible price for it. There are now so many cases in the US that, for all practical purposes, thorough contact tracing is no longer possible. The cat is out of the bag. We are in some ways past that, because we just don't have the number of people to do it. When you're talking about millions being infected, you need certain kinds of soft lockdowns in high transmissibility settings: bars, restaurants, gyms, universities, things like that. Then you need masking. Around that, you need physical distancing. And then around that, you need a testing strategy that works. How much value is it to go in and get a test and find out the results 6 days later? That's not very helpful. But if we can do this and layer these appropriately and convince the public, ideally without having to make it mandatory, though I think we're going to have to, is how would you control this? And I think that's what governors are recognizing.